Thanks for watching us. Now I want to explain what CovidMatrix platform is and why it can help us. First of all, I want to tell you why and how we design our logo. Our logo conceptually came from the philosophy of Ubuntu from Africa. The philosophy of Ubuntu in Africa says, I am because we are, or humanity towards others. What does it mean? It means we just can survive, or we just are available if we consider as a group, as a humanity altogether. And the other part of this logo came from the heart that is a symbol of the healthy. So if you put these two concepts together, you will reach to our logo, and then you could see automatically you reach to our slogan, all together to be safe. And let me to explain something about the problem because of the pandemic crisis. First of all, because of the pandemic, many governments are starting the quarantine. What does it mean, quarantine? Quarantine have different levels, but the worst one is obligatory lockdown. Obligatory lockdown happens in order to make safety for customers of the industry or for their employees. Another challenge that daily we are struggling with that and make bother us, daily we are hearing more positive diagnosed coronavirus in people. And there is no strong hope about vaccine. There is many research, there is many investigations under clinical trial, but still so far to have a vaccine on the table. And we should take care. When we have a pandemic situation, we need vaccine at the level of the 7.5 billion population, which means the logistic that even all the companies of pharmaceutical technology in the world together have not at the moment. Because of the pandemic and because of the lockdown and because of the quarantine, the economy is very close to collapse. And the main concern at the moment is how to reopen it and how we can reopen it safe and make it easy again to go back to the thing that we missed for them. Parties and being with our friends, with our families, playing with children in a park, going to the ceremonies, conferences, beaches. We really missed that. But how we can do that? How we can try to recover that good memories again, which some days it was very routine, but now it's got dream. So, in order to make a bridge between lockdown and our dreams of being normal again, we are suggesting CovidMatrix platform. CovidMatrix platform is an integrated system that includes mobile applications, some web services. Web services means connection between websites and the applications. That based on the cloud servers, we are providing the information, we are collecting the information. Another module in the CovidMatrix platform is dynamic map, that we can open it, and on that map we can see the hotspot regioning. And this map has several features that I will explain to you later in the level of application. Another module in the CovidMatrix platform is dashboards. Dashboards means the interface that we are providing for organizations, for governments, for any business owners to be in communication with our platform, with our mainframe technology anonymously, and receive the reports that can provide them make more wiser decision at the moment. We have QR code generator that make identity for any user of the application, for any system that is connected to the applications. And we have another application in this platform to read, log, record the QR code of the people, of the users at any indoors places, which can help us to understand at what time who are together at the same place, which can have a same risk of disease because of the corona positive diagnosed of one of them up to 14 days after. The other thing is our platform is providing is immunity passport. What does it mean? It means that we have a form in the application or the system in the platform in communication between different type of information would provide the status of the safe, healthy, risky, and suspend and positive and patients and so many other status that is defined based on the information. But this status provides us the capability or the passport to move on in society with how level of the protection. For example, if some people get corona and survive from the disease, then they would have antibody in their blood. And this antibody, based on our prior knowledge, can make up to 1 year, at least 1 year, immunity to do not take the disease again. So it's a good news. And if we know this information, we can segment or we can categorize the population in high risk, low risk, and no risk. We have user status that I mentioned, and also we designed knowledge-based predictive models in the system that daily, based on your contacts, based on your contracts with people of the corona positive and your availability in the area that people are sick more than normal, would provide or would calculate the risk of the being contacted with the corona positive and how and make it under monitor for next 14 days based on the high risk situation to find the possible positive patients. And we can detect them and we can cut the chain in case of the positiveness and make sure that, and the people who is in this situation that have a high risk can bring their attention about their member of the family to keep them safe and to be away a little bit from them since doing the test or since passing the 14 days to make sure that they are not got sick. Okay. And Now I want to show you the interface of the application. As you can see in this application of the CovidMatrix application, you can see the history with the chronic disease of information. So every person for himself and his family member inserting the history of the chronic diseases. We provided the opportunity to add up to 9 persons in one application that are living in the same home, in the same house, that they do not have a smartphone, like children, like old people, or even some people that do not like smartphone or do not afraid of having a smartphone. So this information daily can insert with one smartphone through one application, but each of them receives their own identity code. And this identity code is printable. And in order to prevent fraud and abusing of the other's identity, we are changing this ID daily. Or with the request of the user, instantly they can receive a new code, temporary code for the identification. We also provide another opportunity as a tips of the day. So daily we can send educational material and protective material for each person. In order to support security and privacy, we did very high effort to make your data safe, to do not accessible for any identity without your permission. And we provided this permittability issue in the application, and at any time we can change it. But this is your choice to share your data, to permit to share your data with anonymous situation, with unknown situation, with the researcher or the trial center or the hospital center or the SUS integral system. But this permission is valid since you are not yet positive. When someone in the network getting positive, the information will share with the system in order to be able to cut the chain of the contagions. This application designed for multi-language and multi-server means if you have this application, maybe based on the population that is, or territory that is going to be implemented, different server for different cities may be available. So by switching the territory of one server, you can manually switch between the server and receiving the new information from the new server. But this is still secure and safe for your privacy. This is one of the biggest and most time-consuming effort that we did to provide safety for users' privacy information. As you can see, the risk ratio number in the application. So in any situation that you are in the city, you will receive, you can see the risk ratio of that region, and this risk ratio of the region provide you corresponding protection notification and advisement that you need to do. For example, in the risk ratio of 10 as a maximum risk ratio of the region, you need to be protected and the maximum distance from the people who is in that area, and you should make sure that even you and your friend that you are in contact in that region to be protected. You have the choice of SOS in a situation that you are not able to call or to talk or even to move. With pushing the SOS button, then your request will send to the trial center and they will follow you for next steps to send ambulance or find you and evaluate your situation. There is another option that we made in the application is SUS, means suspected report. Suspected report means any citizen is responsible to vigilantly monitor their environment in order to see if there is some tag, if there is some action, if there is some people who is making risk the society's health, can take a film, put voice on that, with the location sent to the server. And this service is sharing with the social police in order to find the situation and try to help people to solving the risk situation. We also designed another decision support system, means a system based on your response to the questionnaire will provide you the feedback, what is the next action and what you need to do. Also, we provided another feature, another advantage in this application, that when you reach to your network friends, you can unlimitedly scan their ID in your cell phone and make your close friend network. And if one person in your close friend network gets sick, the server automatically sends notification for everyone to be cautious and try to do the test for yourself in order to make sure that you are not contracted to the disease. Okay, this is the main features of the application. And now I want to explain to you the architecture of this application. So, for architecture of the application, I can say, you can see the features that I explained in previous slides. Now you can see how these features are forming. The digital path is going to extract from the information from the map and is providing you based on the GPS data that your cell phone is sharing with the server. But this is your privacy and just for your safety. The second module is the risk ratio decision support that I mentioned. That is a system that semi-automatically computing the risk of the day for you, and then based on that providing you some notification, some tasks to do. Daily, you have a health survey that you can fill it several times in day. You can fill it as you think your health status has changed. You can fill it again. But in any 24 hours, it's needed to fill at least one time. And the system will follow this issue daily. At least you have one time filling these forms for each member of your family that inserted in your cell phone. The SOS is providing two different actions, means calling to ambulatory center and sending your information to triage center automatically. Or it can be activated based on the question, so there is process for that. Suspected report, as I mentioned, sending to the server and sharing with the social police. The close friends, you can scan the identity of your friends and keep it as your network. And if some of them are getting sick, you will be informed. Family members, as I mentioned, is the survey and the other information you need to fill and validate their identification. And COVID status QR code is a code generator, unique but temporary for every person daily, at least daily, but you can ask for earlier renewal of that by just pushing a button. So this is the architecture of the application. It's going to help us to solve the problem in these days. And for security and validation, we are asking for CPF and birth date, means national ID number plus your birth date would be validated with the formal system of the country to make sure that all information that entered to the system are valid for medical system and for Fast Act in future. Thank you.